Good day, my dear students. Welcome to the world of vagaries. Of late, it is not uncommon to get certain weird topics or vague topics as such. Bioterrorism is one that has recently haunted the students of MGR Medical University. The subheadings in this case are a little different. Always, we should be familiar with the subject and then go to the subheadings. In which case, I would realize that there is something called a prototype, organisms, biological weapon, a diagnostic approach, biosurveillance, and organizations concerned. These are all not subheadings that we usually come across. Now let us see what the text has got in store for us. It is defined as the use of agents such as pathogenic organisms or their toxins, biological toxins that produce death or disease in humans, animals, as well as plants. And these are used for terrorist purposes. And hence the word bioterrorism. They need not be microorganisms as such, but it could be because of the various toxins that they produce. And hence there is an increased amount of resistance to the antibiotics and the vaccines that we have got in store. So we are thrown off gear, and it has been a fear everywhere, including Ukraine. Going back into the history of mankind, bioterrorism has been used as an alternative to the conventional weapons. I will quote a few instances. Poisoning of the wells by ergot in Mesopotamia. A beautiful picture that has been drawn and stolen from the net. In the 1700s, blankets with smallpox were given or distributed for the sake of inflicting smallpox. The purpose of this bioterrorism includes mortality, morbidity, or more commonly, to raise a sense of fear and to develop deserted towns, easy to occupy, or leave it as such, as I shall be telling you in the last slide. And these are all some of the examples you people can go through. There is a plague and then a black death, smallpox, etc. Now, what are the common infections that can be inflicted by bioterrorism? Yellow fever, cholera, typhoid, smallpox, measles and mumps, SARS, and Ebola. These have been mentioned, and not our COVID-19. Bacillus anthracis is quite famous in this context. And this is a transmission electron microscope showing flaviviridae. So the common names we people should be having in mind. It appears to be more of microbiology, but then it has got effect on the human body as such. This is a painting depicting R.A.T.S conquering Mexico. Aztecs were the natives of that, and they had the habit of eating the corpses, it has been mentioned. Whether it is accidental or intentional, smallpox was infused into the population, and it led to the victory, so on and so forth. Now, this is something that we should memorize, and probably the world itself is seeing the beautiful face of it and now how it appears. This is a logo for memorizing. What are the properties of an effective biological weapon? And this set of criteria The reference is given over here. I would like you people to kindly memorize. It should cause a high morbidity and mortality. There should be a person-to-person spread. There should be a low dose which can be highly infectious. And there should be a lack of vaccine or antibiotic against it. It should cause anxiety in the public. And the pathogen can be available, it can be produced quite easily. It should have an environmental stability so that it stays. Take the example of the anthrax spores, for example. Also, there should be a scope for research and development. You try to develop a kind of a variation of it so that it becomes more and more resistant. And it should have a potential to be weaponized. These are all the criteria of a biological weapon. This is a beautiful list. I would like you people to kindly memorize it. A diagnostic report. This is no different from the usual procedure that is being followed. So there is a patient coming with symptoms which is being evaluated. There is a diagnostic test. Then finally empiric antibiotics are prescribed, etc. In the meantime, you find that a sample has been taken and it undergoes all the diagnostic tests. There should be a clinical correlation. There should be no contamination in the sample. The laboratory threshold and the cultures should be established, and there should be a true infection and not a contamination otherwise. You should be able to prescribe ultimately the antibiotic for which it is sensitive. So this is the usual protocol that is being followed by microbiology, a commendable department. Now, the examples of bioterrorism. This again is a very simplistic list. I would like you to kindly memorize it. Many of this will be knowing. In such a case, I would like you people to kindly memorize whatever organism that comes to your mind you are familiar with. Bacillus anthracis, for example. Salmonella typhi, typhimurium, etc. Whatever you are familiar with. Giardia again in parasites. Viruses, the Ebola, smallpox, etc. Whatever comes to your mind, and this is our friend, the Ebola virus. Kindly have a list with you that will be an armamentarium for you. Dear students, this is the categorization of the organisms causing bioterrorism. The list of organisms is over here. What are the characteristics and which category it fits in? There are three categories as such: A, B, and C. A is for high mortality, B for moderate morbidity or mortality, and it is easy to disseminate. And C is an emerging group, such as the Ebola, etc. So this particular list, I would like you people to kindly memorize. For example, the characters are given over here. And it is common to all the organisms in this group, not accordingly. So it is easy to disseminate. It causes a high mortality, public impact is high, causes panic, so on and so forth. Similarly, here it is moderate, whereas these are emerging pathogens. So I would like you people to kindly read up this list. You cannot by heart the entire list of organisms. Have 2 or 3 examples for each group. That is more than enough. So, what are the properties of an ideal biological weapon? Organism we had seen. A weapon as such is slightly different. It should be easy to produce in large quantities. It should be transmitted, transported, and disseminated. Inexpensive as such, causing a person-to-person transmission, widespread morbidity, mortality. No immunity should be there against it. And it should be surviving extremes of temperatures as well as drying, etc. And it affects the public health as well as the government resources. Even if there is going to be a research or antibiotic protection, etc., it drains the exchequer of the government. It results in panic and social disruption, and airborne spread is considered more effective than oral spread. This is again almost a similar replica of the original list worth memorizing. There are certain list of organizations which are dealing with this biological disaster and bioterrorism. These are a few. Some we already know, the CAP, the protocol that we are following. The US Department of Health and Human Resources, Laboratory Response Network, Center for Disease Control, Association of Public Health Laboratories. So these are all some of the organizations. Maybe one or two you people can mention, definitely. And this pyramid I shall be explaining subsequently. Now, how do you plan and respond to a bioterrorism? This is the protocol that is followed by the government as well as the medical centers. First is subcritical, in which you will have to find out whether it is an animal source or a human source, and what is the degree of it that is involved. The next one will be supercritical. So this is of great importance. What is the exact human pathogen in it? What is the toxin and what is the response to it? So this is one way of studying, planning and response. So there should be identification systems. There should be methods for use for the biological agents. There should be an assessment of the extent of the hazards. Forensic technology can be used. Decontamination technologies should be put into force. And there should be early detection and rapid response. Imagine if something is bursting up as in a war. So these things are of great importance. The great list is again given over here. What are the activities? What is the planning design? How do you collect the data? What is the correlation of it? Who are all the analysts? Their interpretation. They study the dissemination, and then finally they apply the program. They get the data from the various sources, and research, etc., may be giving us inputs. So this is a mode of plan. Today, being a doctor and a pathologist, you might be very well called for your comments on such an instance. So in 1999, there was a bioterrorism in Pittsburgh and R.A.T.S, real-time outbreak disease surveillance. Sometimes it can happen in real life itself. It is not during a test. So how do you deal with it? So these are the things. There will be microbiology laboratories, sentinel and reference laboratories. I shall be telling you what it is. And there should be a variety of tests that should be put into force, such as a stain, a culture, then the sampling from the various sources, PCR, and other modalities of diagnosis, flow cytometry. Now, what are the modes of spread of these organisms? In a warfare, spray, for example, it can be an aerosol or it can be across the border, but then it has got its own risk. Sealed covers, this is very common. I shall be showing you some pictures of it. Corpuses, the organisms might be infused into the dead corpuses of the enemies and left in their territory so that it spreads. Feces, this was used in early history as one of the modes of bioterrorism. Animals as such. The foot-mouth virus. So this is one that affects a range of animals over here, and you find that one is almost crying or there is a bleeding nostril. This again is an algorithmic approach. Always you find that there has to be a systematic approach. Microbiology, in fact, follows it. So the organism, whether it is motile or non-motile, what else is it? Is it gram positive or gram negative? Okay. What are all the cultures that is possible? And what are all the other things? And then the range of sensitivities. So finally, they come to a diagnosis of culture and sensitivity. The same modality should be followed for any of the sample that is obtained from the war front. So bioterrorism, the past, present, and future. I had given you some examples of the past, and it is of doubt whether it is being put into force in the present. And future, of course, this is something that cannot be done away with. And these are some of the protective mechanisms that we will have to adapt, particularly when you are going to the war front to collect the samples or study the situation. This is an important one. Always you find that there will be a primary, secondary, and a tertiary care. In hospitals also, you find that there is a primary health center. Then there is a secondary center and a tertiary center. Here also you find that there can be sentinel labs. It is just to recognize or to rule out. And they will be referring to the reference labs, which will be doing the confirmatory tests. And after confirmation, they will be sent to the national laboratory, wherein there are certain definite characters which will be again confirmed. In India, for example, Pune is one of the centers. Even for the COVID-19, a lot of investigation has been done across the country, and it has been finally confirmed in some areas. And this is a wonderful reference from which I picked up this pyramid. Kindly explain this in your answer. These are the list of viruses. What are all the various viruses? I had spoken about the bacteria. So there can be the Ebola virus, the Bacillus anthracis. This is more of a bacteria. Then there is a bubonic plague, etc. So what are all the viruses, the bacteria, etc. And what is the mode of spread? And whether it is gram positive, gram negative, etc. And what can be the methods of diagnosis? For example, anthracis, it can be anthrax, PX01 and 02. Easy to grow in culture, and PCR can be a method of diagnosis. Tularemia, there can be vaccines which are present. And smallpox, there can be molecular assays that can be done. That is a danger in all this. Smallpox is almost eradicated, but it is present in a few countries as the research shows. And these can at any time be used, or sometimes if there is going to be some carelessness, again flare up to inflict the entire mankind. So this is the example of the hand, foot, and mouth disease. So you find that there are vesicular rashes that are seen everywhere. And this is an example of the bubonic plague. So even recently it has been there. There was an outbreak of it in Europe, and this has come as a question for us in the recent past. As I told you that there are some organisms and the diseases. So you can memorize a few from category A, the category B, and category C. So these are some of the viruses that have been mentioned along with Ebola and the COVID-19. And these are the viruses and the organisms. Kindly memorize them. This is a picture of chlamydia. Chlamydia, you find that there can be inclusions. Sometimes you get intracytoplasmic inclusions that is seen over here. In certain organisms, we get intranuclear inclusions. And it causes what is called a cytotosis that can be spread by means of birds. Whether these were used as modes of weapons, we do not know. Bioterrorism. So you should be familiar with the consequences of the attack and what is the likelihood of the attack and how do you deal with it. What will be the biohazard it causes, what can be the vulnerability. And what will be the capability of the attacker, etc. So all these will have to be studied if you want to combat bioterrorism. Anthrax, our friend. There are different forms of this. It can be respiratory, it can be gastrointestinal, it can be cutaneous. Anthrax, anthracotic pigments, comes from the Greek word meaning black, used for bioterrorism, a prototype, warfare, dispersed as spores, so it can rest there for quite some time before it proliferates. It is an ideal bioweapon. Postal is one of the modes of spread or communication. And penicillin is a wonder drug that is used. So it is rod shaped, gram positive, and a few spores are sufficient to cause enormous catastrophe. It is a disease of the cattle, and it can spread from the animals, such as the goat hair. And these are all the manifestations of it and the characters. It causes or produces an endotoxin which can spread to the mediastinum and pleura. Ultimately, there can be a cardiovascular collapse. And this was quite common recently when the Twin Towers were attacked in the US. And this was one of the modalities. There were the covers, sealed covers in which the anthrax spores were there, and many people, including the people to whom it was addressed, as well as the postal staff, were affected by it. And this is a picture of the anthrax bacillus, courtesy R.A.T.S. So these are gram positive and they are slender, etc. And it can affect various tissues, including the liver, as is shown over here. I would like you students to kindly give your comments on the picture. These cattle were used as carriers of these bioweapons. And when they cross the borders, they obviously carry the inflicting organisms along with them. And this is one comment: the easiest place to get anthrax is in the refrigerator of a laboratory. Remember typhoid Mary and any others, you find that they can spread the infections as such. And many people working in the microbiology laboratory should be careful of taking water from the refrigerator. This is the island, Brunad Island, that is there. And it has been almost deserted. Nothing was there, but because of anthrax. And they say that there are thousands and lakhs of spores over there, which could become activated at any time. And this is a picture of the black fever. Thank you.